Florida's abortion rate is down nearly 46% from just last year, a figure that highlights how much has changed since the U.S. Supreme Court's landmark decision to overturn Roe versus Wade. Here to talk about the changing landscape for women's health care is Kelly Flynn. She is president and CEO of a Woman's Choice of Jacksonville, an obstetrics and gynecology medical clinic here. Welcome, Kelly.
Thank you, Anne, for having me today.
Thank you so much for being here. So this is in Florida by far the largest decrease that we've seen in the country, really more than twice as high as other states. The latest numbers from the state show that the number of abortions in Florida is down by 17,000 in a one-year period. As I said, that's almost 46%. Can you kind of explain to us what that means? Is the net number of people getting abortions also declining?
What we can tell right now is that as a result of the 6-week ban, yes, the numbers have decreased. However, we're still seeing patients in our other clinics that aren't able to be seen here in Florida. Um, sorry. We have noticed what we've had to do is to consolidate our days to where we can accommodate the patients to see the numbers that we're seeing, which are declined.
Yeah.
Um,
And your own clinic, I mean, to be clear, you have had to cut your hours significantly, or you have cut your hours significantly. Um, the number of patients that you're seeing reflects that decline. Is that right?
Absolutely. So a year ago, when we had, right before the 6-week ban, our parking lot was full. We had probably 40 patients just before the 6-week ban trying to get in to be seen. Then right after that, the decline immediately happened. So many patients don't even know that they are pregnant at 6 weeks. So we are still able to accommodate most patients under 6 weeks, and those that are past the 6 weeks, we can send them to our North Carolina and Virginia office. And those are generally patients with means. It is difficult for patients to travel. We've done our best to help navigate this, to help patients get to, cross 2 states to be able to be seen. So this is a real problem with healthcare in the state, and the fact that it's gotten this far is cruel, and it's damaging to women's healthcare.
And so your own hours, I mean, you said that your parking lot used to be full, your waiting room used to be full. Now, what is the reality that you're seeing?
Um, y- it's um, our staff. They are very loyal. They are here for the patients. They are here for the cause. And we are doing our very best to take every single call that we can to help every patient that we can throughout the surrounding states, especially patients that are coming from Mississippi, Louisiana, Texas, they're trying to find a way. We get patients that are still seeking help, so we try to navigate them to North Carolina and to Virginia right now.
If you're just joining us, I am talking to Kelly Flynn. She is president and CEO of A Woman's Choice in Jacksonville. And we're talking about some new numbers on the number of abortions performed in the state that just came out, showing a nearly 46% decrease in the number of abortions performed in Florida. That's just in a one-year period. Talking about some of the impacts on patients and providers as well. So I want to just ask you, I mean, Florida has a 6-week ban, which basically means if you're beyond 6 weeks, you can't get an abortion in this state. There are some rare exceptions, but by and large, of the 17,000 some odd abortions that were performed in the state last year, most of them are first trimester and not beyond. So can you tell us what happens when you see a patient that comes in that is beyond that window?
Yes. So patients, when they schedule their appointment, they are required by the state to have a 24-hour in-person consent that has to be done by the physician. So the first part of their process, they come in, they have their lab work done, they do an ultrasound. If in fact they are over that 6-week mark, then they are unable to be seen. So we refer them to our clinic in North Carolina or Virginia. However, North Carolina has a 72-hour waiting period.
So they have a 12-week limit, but a longer waiting period.
That's correct.
So what happens when you send someone for a longer waiting period. They just go up, get seen, and then wait.
Yes, we do everything we can to try to get them consented in Florida if we have a physician or a nurse with a multi-state license, which is difficult to find sometimes. We've had a patient that got on a bus from Florida, went to North Carolina, got her 72-hour consent, turned around, got back on the bus, came back to Florida, took care of her children, then went back on the bus to North Carolina to have her procedure, to then come back. So round and round, she was on a bus for 96 hours to have an abortion.
That's a lot. And so, I mean, for people who are coming in and who do meet that window within the 6-week limit, and as you say, most women don't know that they're pregnant at 6 weeks. But for those that are able to come in and get service, what are the restrictions in Florida? Is it just the 24-hour limit? Are there other restrictions in place?
There's
the 24-hour waiting period.
Yeah, there's a 24-hour in-person waiting period, and the 6 weeks, of course. So anything past that, if a patient presents at 6 weeks in one day, we are unable to see her. She has to go to another state or continue her pregnancy.
We've got a call. If you can pop your headphones on, you'll be able to hear the question. I think it's from Matt on the north side. Good morning, Matt. Welcome to First Coast Connect. Go ahead with your question.
Good morning, ladies. Thanks for your programming and support for NPR needs to continue. My question is, are there any kind of statistics indicating the number of women who are near death before a physician can go ahead and perform a medically needed abortion? Sometimes these are not scheduled. They are just emergencies. What kind of statistics do you have to show the ladies who are in dire near-death situations before they can get the help they need? Thank you.
Thanks, Matt. Do you have that kind of data available?
Don't have the numbers. What I can tell you is that the exceptions are very restrictive. So if a patient presents with a medical emergency, life or death, then it's really up to the physician to make that decision. I know many physicians right now are afraid to approach that for fear of losing their license. And the other exception is fetal anomalies. Okay, so if a patient has fetal heart tones but knows that the pregnancy won't survive after delivery, she's still unable to terminate her pregnancy.
And there are certain cases, I think, that you have mentioned, something called anencephaly cases, where I guess the children typically don't survive longer than a couple hours or days, but very often that birth defect, very severe birth defect, isn't detected until, maybe 16 weeks into the pregnancy. So they're sort of well beyond this early first trimester.
Right, that's correct. And if a fetus still has fetal heart tones during that pregnancy, then the patient is unable to terminate. We'll have to continue that pregnancy and then deliver.
And so basically there is no option, at least in Florida.
Not in Florida, no.
Right. Some of your patients go to Virginia. That is a place that does not currently have any restrictions.
That's correct.
So that they are able to get service there. How are they able to manage the cost of travel, the cost of hotel stays, whatever else might be required? Is that just something that they come up with? Are you able to help them raise money?
Yes, we can help them. We have several organizations that help fund our patients. We have funding navigators that work for us that try to help the patients get the funds that they need. We've had people donate to a specific fund that we have at A Woman's Choice that also will help patients with lodging and travel and gas. So we do our very best to make sure that we get patients where they need to go to be seen.
Yeah. We should say we did reach out to the Right to Life folks here in Florida and invite them to participate, either call in or come on the show, and did not hear back. But we did want to talk about this important subject. Kelly Flynn, thank you so much for coming on this morning. We appreciate you. Thanks for all the good information.
Thank you for having me.